So I will call this meeting of the Health and Human Services Committee to order now that we have a quorum, and we have one bill on the docket, and that's House Bill 479. And Representative Dempsey, we're ready for you if you're ready.
Good afternoon. Thank you, Madam Chairman. I appreciate the opportunity to bring this to you. This is HB 479. Basically, it will change the state's licensure law that currently allows the use of independent contractors to bring state law in compliance with IRS and other federal regulations defining an independent contractor. The federal law has 3 tests for an independent contractor. And first is behavioral. Does the company control or have the right to control what the worker does and how the worker does his or her job? Financial. Are the business aspects of the worker's job controlled by the payer? These include things like how the worker's paid, whether expenses are reimbursed, who provides tools and supplies. The third is the type of relationships. Are there written contracts or employee-type benefits, like a pension plan, insurance, vacation pay? Further, many of these workers actually have the characteristics of employees, not independent contractors. They do not have their own employer identification number. They adhere to a dress code of the agency. The state requires annual performance evaluations of these workers, and the state requires a personnel file be maintained on each employee with annual credentialing documentation on file and a TB test annually too, a TB screen. They are covered under the employee workers' compensation with no individual coverage in place, and are covered under the employer's professional liability policy and do not maintain their own insurance or liability. The state regulations for home care services clearly require close, direct supervision of home care personnel, which violates all federal regulations and common law governing the use of independent contractors in home care services. We anticipate the standards of care for home care providers that cannot be contracted out, including formal care plans for their clients, which are suspect to inspection. Simply what this does is to update state law and bring Georgia's home care statutes in line with the federal rules in this area, and recognizes the reality of the employment practices in this industry. We do have 2 witnesses here, I think, 2 people to testify.
Do that now?
I think that would be great, and then we'll take questions and try to answer
Okay.
them.
I have Mr. Grogan. If you'd like to step forward.
Thank you, Madam Chairman and committee. The private home care industry was started years ago and is basically charged with taking care of Georgia citizens that basically do not meet home health criteria under the Georgia Medicare system. This industry takes care of patients anywhere from 4 to 24 hours per day and is not a participant in Medicare. What has made this difficult over the years is that many registries have adopted an independent contractor philosophy, meaning that they are not explaining to these nurses' aides, and that is the caregiver that we're talking about, not LPNs, not RNs, but nurses' aides, and they are qualifying them as independent contractors. Now what happens is, in order to dodge the issues of taxes and things, they report to the aide that they are an independent contractor, but the aides really do not understand what that means. They don't understand that their tax is due and they're going to get a 1099. They don't understand that the state of Georgia is due some taxes out of that. And so when they get the 1099, they sit on it, and nothing really happens. The biggest issue comes in the hiring process that the state of Georgia has dictated, and that is that things like a tuberculin skin test is required, a criminal background is required. When we interview these people at CareMaster Medical Services, my company, and discover that they many times have no clue what a tuberculin skin test is, then we inquire as to how their previous employer did not request one. Then we learn they were an independent contractor. So they're not being held to the same hiring processes that the W-2 employers are, in that they are not going through criminal background checks many times. They are not getting their tuberculin skin test many times. And that's just to name a few that protects our citizens in the state of Georgia. That doesn't take into account all of the financial issues and tax consequences that come into play. Those are the two biggest that confuses and enlarges this loophole and void that we have in this bill. We hope that House Bill 479 will close this loophole so the playing field is leveled and the aides that are taking care of our citizens in the state of Georgia all understand that the same hiring requirements apply throughout. Thank you very much.
Do we have questions for the presenter?
Yes.
We do. Representative Henson?
You're talking about nurses' aides, and I understand.
Yes.
What other employees do personal care homes employ?
Now, this is a private care,
Private care.
not a
I'm
personal
sorry.
care home.
This is only for
private care
care.
services, right. These aides go in. What makes this difficult is these aides go into homes, to the consumer's homes.
But
So, go ahead.
my question is,
Yes.
you have a company,
Mm-hmm.
and you employ people
Correct.
that go in. What other categories of people do you employ? What other categories of people does this affect that might think they're a contractor?
That might think they're a contractor.
Oh, that would want to be a contractor, but in
Really, you possibly could apply that to RNs and LPNs, but it's very well known that unless they hold themselves out to be, I guess, an independent contractor for an insurance agency or something of that nature, going into the homes and having care plans directed, that busts the ability to claim yourself as an independent contractor.
okay, what about therapists, occupational therapists or such? Do you employ them also?
Do not, no. That is not under private care licensure.
Okay, but like RNs, is it possible they'd work for 2 or 3 different companies?
That is
And-
possible.
And therefore, would they be an independent contractor or would they be an employee? How do you
They would be
differentiate at that
They
point?
would be an employee based upon the fact they're operating under a care plan that is derived from the physician, and that care plan has to be supervised. So someone within the company that sends the nurse out must be supervising this care plan.
Okay, so can I take this a step further?
Certainly.
What other companies in Georgia, in terms of health care, also are going into this differentiation between an independent contractor and an employee? Because you have folks, I'm going to take the dental field, you will have hygienists
Correct.
who possibly work at several offices and are independent contractors, but they are operating under the rules and regs of a dentist.
Mhm.
You also have dentists in other cases
Mhm.
that would hold themselves out as an independent contractor, but they're restricted on how, well, they should dress a certain way, and most of them do, but they also are certain rules and regs within each office that they have to operate under.
Mhm.
So, are they independent contractors, or are they employees? Is this going to,
I don't
know
know
you're
how
saying that this is specific to,
private home care.
yeah,
Yeah. I don't know how that industry operates in the home care industry, because the medical care must be supervised, and maybe there may be a distinction in that the dentist is on site. The physician is not on site in these homes. So we are following a care plan that is supervised by a physician, by a nursing supervisor within the company, and is supervising that nurse that's going to the home. That may be a distinction.
maybe it's Representative Dempsey I should be asking this question of.
Okay.
Chairman had something to say.
I did. Thank you for letting me interrupt. Representative Henson, are you concerned that this might affect other people?
Yes.
Is that the concern?
Yes.
I just asked Legislative Counsel once again to assure me that this was just to home care. It does not affect any of the other
Disciplines, yeah.
disciplines.
And it will not.
It will not. Is that correct? Betsy? It won't.
Okay, fine, thank
All
you.
right. Thank you very much.
Thank you.
I guess more than anything will it be
Oh.
precedent setting.
Okay. Representative Hudson.
Just would like to make a comment. Coming from a long career in home health, I applaud this bill. Thank you.
Thank you very much.
That's all right. Thank you very much. And then we have Mr. Gruenfelder. I read it correctly, and if you'll tell us who you're with also. Yeah.
Thank you, Madam and Committee. It's Gruensfelder.
Okay.
Slightly German.
Gruenfelder. Just a little bit. I won't tell you my middle name.
Just a wee bit.
It's a little German too.
As my industry associate Eddie had talked about, what one of the intents to trying to get this changed was to eliminate the independent contractor provision in this law. Originally, when the law was written, which my father was one of the co-authors of back in 1996 with Zell Miller, back at that time, it was never the intent to have this in there in the first place, and it got put in there at the last minute somehow and slipped by.
Oh, that never happens in this day and age.
So basically, we're trying. Well, a couple of things that we're trying to do is number one is that some of these agencies that are out there utilizing the independent contractors, that, like Eddie was saying, that they're not totally knowledgeable about how they're being utilized, and in this independent contractor capacity, working them that way, they're circumventing certain laws and that are in place that actually protect the caregiver. Number one, there could be some things. Some people are covered with workers' comp with these agencies, but as an independent contractor, then they're not eligible for unemployment insurance. They are also not subject to basically federal wage and hour issues. So they're sidestepping some of the things that are in place to protect the worker that are out there. It's also with the increased supervision that is required under our licensure right now for private home care providers. I think the level of caregiver will increase, because they will be up to date on these things. They need to have their annual in-services that are required. Independent contractors, you say, where's your in-services? I don't have any. Make sure that they have their annual in-services. They're industry related. On another aspect too, like Eddie Grogan had stated, that they kind of sit on their 1099s. I think this will be an issue to raise revenue for the state. And I think that potentially this could help also level the playing field for those of us who are playing by the rules and those who are sidestepping some of the rules.
Okay, I think you have a question. Representative Pack.
Two questions. Number one, I know you said that provision regarding the independent contractor was put in at the last minute, but could you glean anything from why that was put in at the last minute?
For this, the way this industry operates, it's just not an appropriate business model.
Okay.
Because they have to be supervised, so it doesn't meet the federal requirements of the definition of independent contractor.
Okay. Are there, assuming that they're independent contractors, people who are the ones actually going into the house and providing service, are they under any regulations or quality control issues that you're concerned about currently? Are they regulated in any way?
Well, again, as we were talking about, when they go into the home, they're operating under a service provision plan, which is basically a detailed list of duties that they're supposed to do for that patient. That is supervised by one of the employee RNs of the agency. Okay, so they're supposed to be, since they're being supervised, they cannot be the independent contractor. But when they're independent contractor, these companies that are sort of taking advantage of them are not making sure that they have all their credentials. Their tuberculin testing, which is a test to eliminate that they are carrying that and thereby not infecting patients. They're not having their annual in-services to keep their skills up to date for the industry. Maintaining their CPR cards, first aid training, and just the general knowledge of the issues, or not the issues, but the task that they do in the home care setting. Meal preparation, nutrition, how to handle special cases with patients, who might have special psychological issues due to brain injuries or spinal cord injuries or things like that.
apart from interfering with the contractual rights between the employer and employee, are there other ways to get and address the issues that you just raised?
I'm not sure that you're trying to avoid what issue? I'm sorry, say that.
Well, the concern I have, and is that I generally don't like any law that encroaches upon the right to contract between two parties. And I'm trying to figure out a way if there's a way to address the concerns just raised without having to dictate that you could only provide the service through an employee and not through a contractor. Because I think in terms of employer and employee law and agency law, we have this independent contractor concept that's prevalent everywhere. And I don't want to set a precedent where saying, well, to protect these people, we're going to start demanding that you have to hire these folks, which I think is very anti-free market. So I'm asking you if there's any way to address the concerns that you have other than dictating that you actually have to hire these people and provide these services as an employee.
Mr. Grogan, would you like to add and come back up also and help out? You looked anxious to do that. And I call this a simple little bill, and we wouldn't be here but a short amount of time.
Representative Pack, I think what is happening is that's what's happening now. Is the system that we have in place now is the independent relationship between the independent contractor and the employee is being handled by skirting an issue where FLSA comes into place. So I, as a potential employer, don't want to get involved in that. So I have to I have to work with my aides more like a registry. So here's the concept of a registry. If you call me and need a home health care worker, then I'm going to match you with one. That would be an independent contractor. It's up to you to determine if they're safe, if they're disease-free, if they have a criminal history, and all of those things. If I do that, then I am looked at under FLSA as an employer. That would be the ideal concept of the relationship. What we have in Georgia is a convoluted dovetailing of the two systems to where I am supervising, I am doing criminal background checks, I may not be doing those, I may not be doing a tuberculin test because I don't want to appear as an employer. So I'm trying to straddle the fence as an independent contractor. Does that help any?
I understand that, but that happens all the time.
Right.
So it's not. So if you want to, let's say you are one of the people that want to work as an independent contractor.
Mm-hmm.
I would like to meet all the provisions that you have. Right.
Then I would have to tell you to you need to advertise your services. You need an EIN number. You need your own work comp.
Okay.
You need your own professional liability, just
Or-
like a plumber.
Yeah, or that person could choose not to hire them as an independent contractor.
Absolutely, of which they would not be able, under Georgia law, they would not be able to send them into the home. As an independent contractor, under private care, under the license we're speaking of right now, if there was no license issue, this would not be an issue.
Okay.
But the fact that there is a license and the license dictates that these things need to be performed, then that is what throws us into a conflict with the federal FLSA. And that's why we're here today, is that conflict.
Okay.
All right.
I think I understand you, but I think that conflict occurs in every context of employer and employee.
It does, but I think what heightens the issue here is we're sending folks into people's homes they're not like a plumber that's going to go in and perform a service and leave. They're there for a minimum of 4 to 24 hours a day. So these consumers, especially our aged and elderly blind, are at risk. They're at risk of fraud. They're at risk of theft. They're at risk of a lot of different things that a typical employer independent contractor relationship wouldn't be there. If I'm a plumber, I'm going to go in, perform my service, and be gone. I'm not going to be there 3 and 4 hours every day or every other day. So that's what the difference is, I believe. Thank you.
Representative Pack, I will tell you that elder abuse is on the rise in the state of Georgia. They had 12,000 cases reported last year. They think it's barely 10% of the elder abuse across our state. And unfortunately, sometimes with the sick and disabled, the ability to choose the correct person to help you is a problem. But that's just an aside. I think we'll be seeing some things on elder abuse come forward, not necessarily in this committee, but it's becoming a major problem in our state as we age, and we are aging at four times faster than we are getting young people. Representative Byrd. I'll pass. Representative Hudson. Okay. Can I go through? Let me ask other people before I come back, if you don't mind, Representative Kaiser.
I'm Chairwoman. I know the bill's author and respecter, so I know this is the answer to this, I think, already. But just to clarify the intent, if a provider were to only hire independent contractors, that wouldn't exempt them from any kind of state licensure, right?
If the home care provider only hired independent contractors,
Right.
it wouldn't prevent them from.
Would that exempt them from any kind of state licensure? Well, for the facility.
It's private care.
Yeah, this is.
It's into the
It's
home.
going into
Okay,
a
so-
personal residence of
Right.
an individual. You know,
So it doesn't, though.
so
Okay.
I mean, when you
Okay.
say facility, to me that means
Well,
like building with many
provider
members.
regardless, yeah, but I think
Okay.
he just answered my question.
Okay.
Okay. Thank you.
Representative Reinders.
Thank you, Madam Chair, and I apologize, working on the budget, for being a little late. I want to pick up on B.J. Pack and on what you said, Madam Chair. Well, certainly we got elderly abuse that goes on from people that aren't licensed. You know, it wouldn't be fair to necessarily say there's one for the other, but I do want to hit on what Representative Pack was talking about, because your phrase, protect the worker, is a flag to me. We're protecting workers by not providing jobs in South Carolina because they don't meet certain definitions that our friend Newt Gingrich is campaigning on. Some of our friends. You get my point. Protect
I'll
the worker.
give you a good example of where
Please,
we.
please let me. There's some issues going on within this General Assembly in regards to roofers. And do you have to be licensed or not? Now, there's a fine line between public safety and let's protect the turf of individuals, or let's exclude other individuals or services or companies from being able to potentially infringe on what we're doing. We handle scope issues every day here. So when you say things like they may not have to follow, what were we talking about? The minimum wage?
Federal wage an hour?
Yeah. I know you weren't trying to suggest, because I think that was your word. I don't think you were trying to suggest that under your plan you were going to dictate to that person what they must pay.
Well, no.
Well, then why'd you bring the wage part up?
No, they're not protected by federal wage an hour when they're working as an
But
independent
in
contractor.
my mind, do you know whose business that is? That's not ours. That's the person that's making the decision on the hiring. That's not your business. If they want to give me $10 or $15 an hour, a minimum wage or not, we get to, isn't that my decision to make when I hire someone?
Well, sure. I mean, the employer has, the employer's going to offer a wage that what the market will bear, kind of thing.
Or whatever's negotiated, because the market does bear that.
Possibly.
And so that's the only. Go ahead.
I've got an example of
But
that.
I mean, I want to use what he said. So go ahead.
As an independent contractor, having been forced by the IRS to convert from an independent contractor back in 1996 to a W-2 employee, here's the impact. The IRS actually went after the nurses and predominantly the nurses' aides for the unpayment of taxes, because they just did not understand their relationship. A true independent contractor is going to understand that relationship. These nurses' aides do not. They just want a job, and they can get employed, and they don't care. In fact, it's an additive incentive if I don't have taxes taken out of my check. To me that is a bonus. But sooner or later, when the IRS rolls around, something's got to be paid. And that's actually what happened.
You mean like the taxes you take out of the guy that painted your house recently, or the taxes you take out of the worker that came and laid your pine straw at your house?
Absolutely. Those
Because we
taxes.
all know everyday Georgians do that every day.
Right, but I didn't call a registry to have one sent over.
Right.
I
And
called him
I'm just trying to
directly.
find that correct
Right.
balance that Representative Pack was trying to find.
Right.
Okay, Representative Reinders, can I jump in?
Sure.
And it is a fine line between public safety, and that's why I brought that up, because Representative Pack is, I understand his questions. But I think the difference is there's not anything in this bill that would keep me from contracting with Representative Randall, to do something if I wanted her to come to the home and do it. You can still do that, but this is when am I reading this right? It's when you have a company that is supposed to be a home health care company that is skirting the law and not making sure that the people uphold. But if like you get people to put pine straw out, if some elderly person wants to contract individually with somebody they know, this doesn't affect them.
Yeah, and I know, but what flagged me, Madam Chair, with all due respect, was stuff like protect the worker and all this. I don't want to take away that individual right of someone to be able to hire who they wanted to hire, was my only point.
But I'm sort of questioning too. I don't.
That balance.
This bill would do nothing
Okay.
to keep the consumer from hiring somebody they knew or they wanted to know, or somebody they saw on Craigslist. Not a good idea, but on Craigslist, to come into their home and take care of them as an independent contractor. Nothing in this bill would affect that.
Nothing in this bill would guarantee someone gets a competitive advantage over someone else.
Company-wise, it wouldn't.
Okay.
Representative Kidd.
I do apologize for being a few minutes late, and this might have been covered, but to follow just one step further than what you just said, excuse me, I require attendant care. The attendant that I hired, who lived with me for a number of years, but now he just lives outside my property, but comes to my house every single solitary day, 7 days a week. He is not a licensed nurse in any shape, form, or fashion. He at one time worked for Shepherd as a nurse assistant, but now he's my employee. I handle him as a contractual agent. He is not licensed. He is an individual, and he provides home health type care for me. Is he covered by this bill one way or the other?
No.
Okay. Then when it says up here, if I may, private home care provider means any person, business entity, corporation, association, and so forth. He's not covered under person. I don't have the whole law in front of me. I just have what the bill says.
Okay. Betsy can address it.
Okay. I thought that was probably the case. I just wanted to make sure. Thank you, Madam Chairman.
Right. Thank you, Betsy. Okay. Representative Clark.
I think my question's been answered. Thank you.
Thank you. Representative Hatchett.
Thank you, Madam Chair. Sorry I was in and out and I don't recall your names, but you had the business where you were having contractors do what we're talking about, correct?
Correct.
Okay. Since that time and your business has changed, have you seen any change in being able to find people to, healthcare providers come in? Are you able to pay the same wage you were paying? I'm just curious as to how, since you're obviously still in business and you changed the way you're doing it.
Well, to be quite honest with you, what we did discover is, unfortunately, as we became a W-2 employer and the interview process became more in depth, when the licensure process came in that we're talking about today, and created a little bit more intent of a hiring process, checking criminal histories and tuberculin test, what we have discovered is that we interview about 10 to 12 to hire 2. So if that gives you an intent of what's out there in our community that the consumers and as independent contractors may be getting, if they're not meeting our hiring processes dictated by the state, then what quality are they getting as an independent contractor?
and if I may ask some of the questions, you're talking, and nobody I think said the word, but you're talking like people that are like sitters. Is that the service you're providing, or am I using the wrong?
Most of them, it could be sitters. Most of them are nurses' aides or certified nurses' aides.
Do you allow those aides to get overtime? Do you, if the individual is comfortable with those people and they want them to stay for more than 8 hours a day, you know, working 12, 14 hours a day, do you actually have to pay them? You actually have to pay them overtime?
Absolutely. Okay. And we either can bill it. Fortunately, the state of Georgia doesn't allow us to bill overtime under the Medicaid program yet. That might be a topic we want to take up. But right now, we are not able to bill the overtime, but it is paid. It is paid.
Thank you.
Representative Beverly.
Hello. Thank you. Thank you. So the definition of an independent contractor is defined by whom?
The independent contractor, predominantly, the definition stems from under the FLSA law, Federal Fair Labor Standards Act, 1962, I believe. But anyway, that's where the predominant definition stems from. And that's what we're held against as business owners. What has happened, I think, is there's been a disconnect between the licensure process and the actual business of delivering private home care in Georgia. So the independent contractor issue probably never was addressed and probably never was thought to be an issue until the licensure process really got into full swing, and we discovered that, you know, criminal backgrounds and tuberculosis skin tests and some of these other hiring processes do impact the level of care that's being delivered in the patient's home.
Sure. So if the person, according to this statute, qualifies as an independent contractor under the 1962 or 64 law, this bill, is it saying that that person then can't contract with a private home health service corporation?
It's saying that if that CNA, let's take for example, meets the qualifications, and there are about 20 points of qualifications for an independent contractor under FLSA. If they meet those qualifications, then in theory, they probably could contract with an individual.
But my question is, can that person who qualifies as an independent contractor under the language of this bill contract with an employee?
No, because it would bust the independent contractor definition, because they're supervised and all of those 20 things that allows them to be an independent contractor are not met under the agency provisions of this license. Does that make sense?
No, it makes sense. But man, the question is you're localizing independent contractor to CNA or, but what if there's a physician or a dentist or someone who is absolutely qualified through the statute that is an independent contractor? That person then wants to contract with a private company to provide that service. That person qualifies as an independent contractor. That person wants to then contract with the private entity. Are you saying that that person then can't do that under this law? So let's forget about the CNA and so forth, but let's talk about something that is irrefutable, an independent contractor. If that irrefutable independent contractor tries to contract with this service, you're saying that can't happen?
In doing this 26 years, sir, I have never had an opportunity where that kind of example would apply.
Okay.
You know, we're delivering care in consumers' homes, and it's delivered at the level of a certified nurse's aide. I've never had an inclination or a individual physician, dentist, or anything higher than that level of care indicate that they would want to provide services in the home as an independent contractor.
All right, Representative Henson.
Thank you very much. Two things. Would it help the bill at all if something was put in that said that the employees, before being sent to home, must be tested for, I guess, tuberculosis. They must have a criminal background check, etc.
That's there. That is the license. That's what makes them not an independent contractor.
Okay, so it's in. And secondly, how many private home contractors are doing this hiring, like under 1099s, etc.? I know you're saying you're running into a problem, and you are, but are you all from the North Georgia area, the Rome area, or is this all over the state, or what?
Mr. Bruinsfelder is from the Atlanta area. I'm from Central Georgia in Griffin, but we do handle statewide services. We're bumping into it only by fact of the aides that we are attempting to hire. That's how we came upon this. I mean, when you're interviewing an aide and ask them for their credentials, one of the credentials being a copy of their tuberculin skin test, and they can't produce it, the next obvious question is, where have you worked previously? Then when they tell us that they have worked in private home care with another company as an independent contractor, that's what brought this issue to light.
But then I'm very confused. I asked what if you added to the bill that they need to be tested for tuberculin skin test. And you're saying it's already in the license. Then how did these folks who have licenses as a CNA or whatever not know that they have to be tested? I mean,
that's not a requirement to be a CNA. It's only a requirement to go into a home and a consumer in Georgia.
okay, thank you.
Representative Pack.
Thank you, Madam Chair. And I apologize to the sponsor of the bill. I didn't really understand the reasoning behind the language change. It looked pretty innocuous. And may I suggest, instead of doing something, infringing upon this relations and contractual rights, would it help and address the issue if a private home care business, when they're sending somebody in as an independent contractor, you require a disclosure that the person coming into the house may not meet the requirements?
To do that, we would have to change and gut the entire licensure process as it stands now, because that is a requirement of the state.
Okay. In addition, they may or may not meet it. I just don't know. Well, my point is, from the employer's perspective, they're hiring an independent contractor and decide that they're going to send somebody as an independent contractor, not as an employee. If they're an employee, the quality control is there.
Right.
If we let the consumer know by disclosure that they may or may not meet these things so that they could choose to use that service or not, would that address it?
That would violate the purpose of this license. We would not be able to, we would not meet licensure requirements under the state of Georgia to do that. The licensure requirement under the state specifically states you must control, you must supervise, you must handle this hiring process specifically as dictated. So to go back to your analogy of the pine straw, I can understand the pine straw. Oh, I'm sorry.
I just was saying, I know you ain't writing a check and taking out taxes every time someone takes pine straw at your house.
But if someone comes up and supervises the pine straw guy, then that kind of puts a whole different spin on things. If you're supervising the pine straw guy, there's not a problem under FLSA. But if a third party comes up and supervises the pine straw put out and makes direction and coaches, and then there's an FLSA conflict. And that's the whole reason we're here today, is that there's an FLSA conflict between how we are dictated to operate through the state of Georgia licensure process and the federal government FLSA. And we need to resolve the conflict. I wish it wasn't there too. It would make things a lot easier, but it is.
I don't see any. Oh, Representative Kidd.
Last
question.
Thank you, Madam Chairman. My last question for sure. In another life, I've represented the Home Health Care Association, and I'm very close to our local hospital in Milledgeville and the groups down there. I think a lot of them like to use contractual agents for a number of reasons. One, they don't have to pay health insurance on them. They don't have to take out certain other things that the person has to do but the person has to do it themselves. But if an agency is licensed by the state and they hire a contractual agent to work for that agency, then that contractual agent would have to meet all the requirements that that agency requires of full-time employees. And I think this particular proposal goes beyond that. I have no problem with trying to see it get worked out somewhere, but at this particular stage, I think it's got some loopholes in it that you might be able to drive a bicycle or a truck through. I don't know which, but I'd like to see it put in a study committee and maybe worked out a little bit before we pass something that could adversely affect the group that want to hire individuals on a contractual basis.
Okay. Representative Mitchell.
Chair, I'd like for the question to be called.
Okay.
I move do pass.
We have a move do pass. Do we have a second? Okay. Any further discussion? Pardon? Okay.
That it be put in a study committee with a date certain to come back. If you don't like it, Madam Chairman, I'll withdraw it.
Thank you. You're getting the facial, expressions really. Let me ask okay, Representative Reinders, you want to weigh in on this?
Yes, I do. And did you say you're getting the facial expression? Well, as your vice chair, let me just do this before I ask my question. I would like to ask legal counsel, not necessarily a legal opinion, but an opinion. Is there anyone in this particular situation, any company in this particular situation, that could gain a competitive advantage because of this bill? I wouldn't ask if I didn't think I knew the answer.
Well, I think I know the answer.
I think you did tell me over there's a greater chance of yes than a no. Is that a fair statement?
Well,
thank you.
Representative Reinders, let me turn I certainly think that if you are a company, and the answer is yes, if you are a company that is not, and you are hiring independent contractors, and you are not requiring them to have a background check, and if you're not requiring them to have the tests, and you're perhaps paying them less because you're not going to be paying the employer part of their Social Security, and you're not going to be carrying insurance on them and so forth, you would definitely have a financial advantage over a company that was playing by the rules, that was hiring people and providing.
I agree, Madam Chairwoman.
So I think you got it on the way. It is a definite
advantage. And if I was in Brownwood, Georgia, where the closest agency that provided that kind of thing was, in Macon, or if I was in some inner city area and I was limited on my income and I had to balance certain things, I just don't, I get a little nervous about restricting that kind of balance.
Okay.
I understand. Thank you.
Let me ask the author of this bill, Representative Dixie.
Yes, ma'am.
Would you, I'm really neutral in this. Would you prefer us to go ahead with a vote, or would you like for me to ask Representative Mitchell to rescind that?